Dogs are known for their unwavering loyalty and companionship, often becoming integral members of our families. As pet owners, it's our responsibility to ensure their well-being, which includes recognizing and understanding their ailments. Two common symptoms pets may exhibit are vomiting and coughing. Though they might appear similar, these signs could indicate very different health issues requiring distinct responses. To begin with, let's dissect the nature of vomiting in dogs. Vomiting occurs when the stomach contents are forcefully expelled through the mouth. It often starts with nausea, where a dog might drool excessively or lick its lips. Following this, you may notice retching or heaving, signs that the stomach is working to eject its contents. Vomiting can be caused by a variety of factors, such as dietary indiscretion, gastrointestinal infections, or even motion sickness. Or concerning causes might be obstructions, toxins, or systemic illnesses. It's important to observe what is vomited. Is it food, bile, or something unusual? This can provide valuable clues as to the underlying cause. Coughing, on the other hand, involves an involuntary reflex that helps clear the airways of any irritants or blockages. When a dog coughs, it emits a sudden outward burst of air from the lungs, sometimes accompanied by a distinctive hacking or wheezing sound. Coughing can result from respiratory infections like kennel cough, which is highly contagious among dogs. Alternatively, it might be due to heartworm disease, tracheal collapse, or even inhalation of foreign objects. The nature of the cough can be quite telling. A deep honking cough might suggest kennel cough, while a dry, persistent cough could be indicative of heart problems. Now, you may wonder, why is it crucial to differentiate between the two? Knowing whether a dog is vomiting or coughing can significantly streamline the veterinary diagnosis process. For instance, repeated vomiting paired with lethargy and diarrhea could suggest a gastrointestinal issue, possibly requiring a specific diet or medication. Conversely, a dog with a persistent cough and difficulty breathing might need a thorough respiratory examination or even chest X-rays. So, how should a concerned pet owner respond? If your dog is vomiting but otherwise alert and playful, monitor its condition closely. A temporary change in diet might be sufficient. However, if vomiting persists or is accompanied by other worrying symptoms such as blood, immediate veterinary attention is necessary. For coughing dogs, try to identify environmental factors that may exacerbate the condition, like smoking or dust. If the cough persists for more than a few days, or if there are additional symptoms like weight loss or difficulty breathing, consult with your veterinarian as soon as possible. In conclusion, while both vomiting and coughing in dogs are common, they require distinct approaches to diagnosis and treatment. Understanding the differences can empower you as a pet owner to make informed decisions, ensuring that your furry friend receives the care they need promptly. Remember, when in doubt, always err on the side of caution and seek professional advice. Your vigilance and proactive approach can make all the difference in your dog's health and happiness.